I used to think that having a caring heart was a weakness, but my grandmother told me that it was actually a strength. And I found out that I can have a job that just allows me to care about people, and I can make a living off of it too. Hello, my name is Beatrice, and I'm a care support coordinator too at HealthPoint.
To me, care support is a very intentional term instead of case management like you hear in most different organizations. I think it comes from respect for the patient, because to us they're not just another case. They're a human being who's in need of something.
Sometimes it's food, sometimes it's housing, sometimes it's transportation, sometimes it's just a call to just say, hey, how are you? How was your doctor's appointment? Is there anything I can help you with?
We've been able to purchase compression stockings. We've been able to purchase things like cargo carts, for patients that are experiencing homelessness. And so I think that for us in this department, that is really the true vision, that we're able to connect the patients to health, but breaking down those social barriers, right? If there's no transportation, I can't go into the doctors. If I don't have money for my copay, that is a barrier. I'd rather feed my family than pay those $25 to go in and get a diabetes check, right? And so we really do strive to break down those barriers. My name is Brenda Castro, and I am the Manager of Patient Engagement and Navigation here at HealthPoint. What I think is unique about care support is the family in care support. We are a family, and we have each other's backs. And when we get stressed, we lift each other up.
I honestly get excited coming in every day and working, because I get to work alongside such unique individuals, and everyone's support and kindness honestly has helped me grow so much. Hi, my name is Hajid. I'm a Patient Engagement and Navigation Coordinator here at HealthPoint. I work for the Care Support Department. I really resonated with HealthPoint's mission in helping everyone access care, because I'm the daughter of refugees, so I was always aware of the different barriers that pose to accessing healthcare, and it was always important to me to kind of have my impact on that and always find some way to help out and give back, and I knew that at HealthPoint I would be able to do that. What I love about being a PENC or a Patient Engagement Navigation Coordinator is that I get to wear a lot of different hats. I do the breast, cervical, colon health program. I also do care support and working closely with our social workers. And I also do Medicare outreach, transitions of care. And it's a position where I'm always able to grow and learn, which is something that I really value. And just the impact that it has on our patients is so meaningful to me. We had a patient who was requesting resources to get connected to the Down syndrome community in King County. I did a bunch of research and I hit some dead ends, but I was able to find the ARC of King County, and they specialize in working with folks with Down syndrome, both kids, teens, and adults. And it was really great because, the patient was an adult, so I think that you get to a certain age where there's not as many resources and help available to you. It's kind of when you're on your own. I remember being so happy coming into work that day to be able to tell the patient, hey, I was finally able to find something. This was an Arab patient, and I'm able to speak Arabic, so I think it was even more special because I know in kind of foreign communities, folks with Down syndrome in our communities aren't always as supported. So I think it meant even more to the patient's father that I was able to find this, and they were able to get connected, and that they knew that they had the support not only from HealthPoint but from their community.
Our mission is important, and our community will be where our kids live when they're older, right? We are building our community for years to come. And I want my kids and my grandchildren to be healthy. If I did not come from where I come, I probably wouldn't be as passionate as I am right now. But I crossed the border, and it was painful, and we almost didn't make it. And I think that every opportunity that I have here in the United States, I make it worth my parents' while for bringing us here and for crossing and for risking their life. And so I give back to my community every single time I possibly can. And that is why I stick to HealthPoint. And it gets hard at times, but I think that all of the reward and really having my team and really seeing how if I show kindness and that I care, it's a domino effect. It starts with kindness and it ends with love. And that is why I'm part of Care Support.